And welcome back. As frequent viewers know, one regular feature of our program is a kind of show and tell, where our guests bring an item, could be a book, could be a photograph. We're not sure. We're going to find out. But it's important to them, reflective of who they are and what they're about. All right, let's see what you all brought for us today. Who wants to go first?
Dr. Chadwick?
Sure. So I have a little purple heart. So this is an object that actually my 8-year-old son gave to me. So I think he got it from a school project. And he handed it to me one day and said, "Mom, I want you to take this with you every day when you go to work so you can think about me." And I think that, for me, one thing that's really important to me is family. I bring this with me, especially when I operate. I kind of put it in my scrub pocket, so it just sits right next to my heart. And he said, "Now you can have a piece of me where you go." So, I think one of the hardest parts of our job is being away from our family. And I think sometimes our patients don't realize how much sacrifice from our end goes into taking care of them, which is something obviously that we know and we do because we like taking care of people. And I think some of the hardest part of our job is taking care of other people when you maybe have a sick kid at home or a family member. So this always reminds me of sort of why I do what I do. And my son told me one day, "I know that, you can't stay home with me always when I'm sick, but I really am proud of you for taking care of other people." So I carry my little heart with me every day, and that kind of keeps me grounded and takes me back to my family.
There you go. Doctor?
Well, I can kind of piggyback off that, I suppose. I brought in these little angels, or what we like to call in Germany Schutzangels, or protective angels, basically. And every year for Christmas, my mom sends me one of these, especially when she can't visit me. And I have, so over the years, I've accumulated many, many, many little protective angels all over the house and all over my car. And it's kind of multiple things that I think of when I have my little protective angels. Obviously thinking of my family and my roots in Germany. Christmas is a very big thing in Germany. It's probably the one holiday that I feel very passionate about. Yeah. And it's the only holiday I take off from work. So Christmas is a very magical time in my house where I decor everything and try basically to revisit a little bit how my childhood was at home in Germany, where we have little Christmas markets all over the city and lights everywhere, and it's just a magical kind of place. But also keeps me kind of grounded in the sense of this is my mom sharing a little bit of home and a little piece of her with me, because obviously I don't get to see her very often when she's away. And she likes to always bring two, so to represent me and my husband, to keep him safe as well. And just wants to make sure that we're doing well and that she's thinking of us and that somebody's watching over us.
I can appreciate that. My wife, if she was here, would say that, she calls me Mr. Christmas because Christmas is my favorite holiday. It's also the only time I take any kind of extended time off.
Yep.
Because in my business, the holidays are the slowest news time of the year. So I'm least likely to be bothered by reporters and media people and journalists. Yep. So yes, I'm a big fan of Christmas. So matter of fact, we've talked about when I retire, we want to do a tour of all the Christmas markets in Europe. So that's on the agenda. Yeah. So I'll get there one way or the other.
Baltimore's trying. They're having a little Christmas market every
Christmas.
That's true. And I always go there and get some ornaments.
It has a German theme, does it not?
Yeah, exactly.
Down at the Inner Harbor?
Down there? Glühwein is not quite right, but but they try. They're trying,
They're trying.
I make my own, so.
Now, as gynecologists, you're dealing with female patients. But, you've had to deal, I'm sure, with spouses, their women's boyfriends, male family members. What kind of advice would you offer the men when it comes to providing support to the women in their lives who are dealing with GYN issues?
So I think, deal with a lot of family members in a surgery capacity. So most of our questions are, how can we support our partner after surgery? So, we usually will go through the different things that can help them in their recovery, what to expect, what they should be looking for, what they should be worried about. And I think that goes a long way just to helping them feel prepared when they bring their partner home, because I think it's sometimes a little bit of a helpless feeling when your partner's in surgery and then you have to go home and care for them. And if you're not medical, that's a scary prospect. So just making sure that we're really clear about instructions and really clear about when they should contact us, and just being very available to them, and making them feel like we're there for them just as much as we are for the patient themselves as well. I think that goes a long way. We have a lot of partners who come to office visits, so we always would welcome that if they have questions about the surgery or the specific condition that their partner is dealing with. I offer, as does Dr. Peters, a lot of like telemedicine visits. Your partner can be there if it's more convenient, and that way they have a chance to feel like they're in the conversation and can ask questions as well.
I would say I feel sometimes very sympathetic to the partners, the male or female partners, more so the males in a way, because it's very difficult for them to know what it's like, right? Obviously, from a gynecologic perspective, right, there are certainly things that a man will never experience, and trying to explain the feelings or the pains that sometimes come with menstruation, obviously, or a lot of other gynecologic conditions, endometriosis specifically, and fibroids that can obviously cause a lot of pain, I think is very difficult. You can have the most supporting, male partner in the world, but they will never know what it feels like to have a cramp. So I think my advice a little bit to those male partners would just be that women are very good at minimizing their symptoms. If you find that it looks like your partner is suffering from maybe a gynecologic condition, to not minimize that and maybe encourage them to seek care. And suggest, hey, maybe this is not normal what you're experiencing. Maybe you ought to go see somebody to figure out if this is normal or not. So again, I actually feel very sympathetic to the male partners, because I think it's very difficult for them to know, what it's obviously like to be a woman. There are experiences that they will never experience, and you can describe to the best of your ability as a woman as to what you're going through, but obviously same thing from the male side, right? There are things that women will never experience that men are experiencing that are hard to kind of comprehend. So my biggest advice a little bit to all the males that are having women that are experiencing difficulties with gynecologic problems, to encourage them to potentially seek care, because a lot of women are very good at essentially gaslighting themselves or minimizing their symptoms and accepting that this is just how life is as a woman, and there's nothing that can be done about it. And I would encourage men to encourage their female partners to say, hey, maybe go see a gynecologist, do see a gynecologic surgeon. Maybe there's something that can be done to help alleviate the symptoms, to make their quality of life better. As a result, always makes the partner's life also better, their quality of life. I always joke with my husband, because obviously he knows what I do and he's in the medical field as well. And I think he's starting to spread some of the GYN knowledge that he has acquired, being around me. And he's always surprised, he says, oh my God, I think there's endometriosis everywhere where I go, And so we joke about this a little bit. And, he's kind of shocked to find out how common some of these gynecologic problems are, and that, women got to speak up for themselves and educate themselves and, seek care whenever they're not doing great.
Dr. Chadwick, Dr. Peters, thank you for your time and your candor. I hope our viewers enjoyed this opportunity to learn a little bit about you, and maybe a thing or two they could apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. So you made it through the credits for Wait, Doctor, I Forgot to Ask. This is where we briefly discuss the question each physician wishes their patients would ask but don't, or the most unusual hand on the doorknob question posed by a patient at the end of their visit. So, any thoughts, questions that you wish they would ask, or that unusual question you got right at the end of a visit?
I think we actually try to be very thorough, and the reason why I'd say I'm not sure I get many questions out the door is I think when patients come and see us, we're often already sometimes the fifth or sixth person that they've seen to try and figure out what may be going on. So I think that process has been very frustrating and hard for patients. So I think by the time patients come to us, we actually spend a very decent amount of time with patients to be able to, maybe as the first person, be able to kind of validate the symptoms that they are experiencing. And hence, as a result, I think all of us try very, very, very hard to answer every question that the patient may have. It may mean that we're running late in clinic, but that I think is important to be able to make sure that we take care of all our patients. And we always tell that to our patients, if we're running late, it's because we're taking care of other patients who have maybe suffered similarly with symptoms that they're coming to see us with. So.
Yeah, I would agree. I think most of the feedback we get is, oh, wow, that had never been explained to me that way before. So, and we always take pride hearing that, I think, because, you realize that it does sometimes take a lot of women, many different physicians and many years before they actually receive a diagnosis. Speaking of this personally, my sister actually just had endometriosis surgery with one of my partners. And she said, I've been having pain for years. If you weren't my sister and didn't tell me that that's what this was, I've mentioned it to other physicians and I've never heard anything about that before. So, I think we understand that when people get to us, they've kind of been through it. I think the only thing I would suggest is that we're gynecologists. Sometimes things we talk about are a bit sensitive. And the only real questions I get as the doorknob are things that people were maybe too embarrassed to ask throughout the visit, or they think, oh my gosh, she's going to be judgmental. And I can say, we'll never feel that way. This is the place where you're supposed to talk about everything. I guarantee you we've heard it all. So, don't ever be afraid to ask something. And if there's something that you really want to get to, talking about it beforehand, especially if it's something that's like really bugging you, we'll be able to spend more time on it. So just making sure that if there's something that's on your agenda that you want to talk about, try to mention it before the doorknob moment. Obviously, we'll always come back in and sit down and talk about it again, but just that you don't have to feel embarrassed about anything that you talk about in our office. We have honestly heard it all, and we're here to help.
Well, that's why we do this show. I've said this many times, but I interviewed a physician, and he told me that, I have patients telling me things on their third and fourth visit that I really needed to hear on their first. So the whole idea behind our program is to help people be more comfortable by seeing sort of physicians outside the OR, outside the sort of the medical world a little bit, not in the exam room, and see who they are a little bit as people. So maybe when they come to see you, as a patient, they're like, well, this is okay. I can talk to you. I can tell you this. I don't need to be embarrassed about it. And so maybe you get some really important information that you need that's going to help this patient maybe avoid a lot of issues and pain that maybe otherwise, if they hadn't spoken up, might have taken a little bit longer to get to. Yeah. So thank you both.
Yeah, sure.
You're welcome.